All right, let's jump right into this explainer with what I think is a totally mind-bending biological paradox. We're looking at why your brain never feels pain. Think about it. The very organ that processes every single ache, ping, and sting in your body is, itself, completely numb. We rely entirely on our brain to tell us when we're hurt, but the master of pain perception is entirely blind to its own tissue damage.
There is just a profound irony in how we experience the physical world, isn't there? Your brain sits right at the center of your nervous system, decoding every distress signal your body sends. Yet, it operates in complete physical silence. It knows pain intimately, but as this quote captures perfectly, it never actually suffers an ache itself. Think about the last time you stubbed your toe. The only reason it hurts so much is because your brain is receiving and processing a signal from your foot. So we really need to understand why the processor itself is immune to this sensation. I mean, why would biology design a system where the alarm system can't detect a fire in its own control room?
So, here is our roadmap for today. 1. The Great Brain Paradox. 2. Anatomy of a nociceptor. 3. Why do headaches hurt? 4. The gate control theory. And 5. The brain constructs pain. Let's get to it.
Section 1. The Great Brain Paradox and Awake Brain Surgery. Let's start with a medical reality that honestly sounds straight out of a sci-fi movie. Neurosurgeons routinely perform brain surgery on wide-awake patients.
This perfectly illustrates our paradox. Doctors numb the scalp and open the skull, sure, but once they actually reach the brain tissue itself, the patient is wide awake, they're talking, answering questions, maybe even playing an instrument, while doctors gently stimulate the brain tissue to map out functions in real time. And the patient feels absolutely nothing from the brain tissue being touched.
From an evolutionary standpoint, this actually makes perfect sense. Your brain is already encased in a protective, bony skull and cushioned by fluid. A traumatic injury severe enough to damage the brain tissue itself is typically catastrophic. So, having pain receptors on the inside of the brain wouldn't really help you escape danger. It would be entirely useless, literally like installing fire alarms inside a completely fireproof vault.
Moving to Section 2, Anatomy of a nociceptor and the biological missing link. What is the brain actually missing at a microscopic level to make it this way?
It all comes down to these nociceptors. These are specialized sensory nerve fibers that actually capture the nasty feeling of a burn, a cut, or extreme pressure and shoot distress signals straight to your spinal cord. Basically, they're your body's dedicated fire alarms. When you accidentally touch a hot stove, it's the nociceptors doing the shouting.
And when you look at where these are located, the biological truth is super clear. Your skin, joints, internal organs, even the meninges, which are the membranes covering your brain, they are absolutely packed with nociceptors. But your actual brain tissue, the gray and white matter, zero, nothing. It is totally blind to its own damage because the hardware just isn't there.
Which brings us to Section 3. Why do headaches hurt? The headache illusion. Now, I know exactly what you're asking right now. You're thinking, if my brain can't feel pain, why is my head pounding after a long day? Well, during a headache or a migraine, it's actually these surrounding structures that are screaming in agony. It's the meninges, your blood vessels, sinus cavities, neck muscles, or cranial nerves. They get inflamed, dilated, and irritated, and they are loaded with nociceptors. But the brain itself, sitting right in the middle of all this chaos, remains totally insensate.
So your brain is essentially just receiving an urgent, flashing report from those inflamed cranial nerves and blood vessels. It decodes that message and generates the conscious experience of pain. It gives you this incredibly convincing illusion that your brain is hurting, but the original physical distress never touched a single brain cell. It's all just a translation error of geography.
Okay, Section 4, the gate control theory, or as I like to call it, the spinal cord bouncer. Let's see how this builds into one of the most influential theories in neuroscience.
To understand this, think about a super common everyday scenario. You accidentally smash your shin or bump your knee against a table. What is the very first thing you do? You grab it and you rub it, right? We do this completely instinctively. But it turns out there is some brilliant, hardwired neurology behind that simple soothing action.
Here's what's happening in your spinal cord. When you bump your knee, small diameter fibers carry that slow, throbbing pain signal. They silence inhibitory interneurons, leaving the nerve gate wide open, and you feel the pain. But
When you rub that knee, you activate large diameter fibers that carry non-painful touch and pressure signals. These large fibers actually excite those inhibitory interneurons. Basically, they slam the gate shut on the slower pain signals before they can even reach the brain. This is exactly how TENS units work. They selectively stimulate non-painful fibers to just close the gate on the pain.
And this brings us to a really profound conclusion by Ronald Melzack, one of the creators of this theory. He said, pain is in the brain, because your brain can actually send signals back down the spinal cord to actively modulate these gates based on your emotional state or expectations. It fundamentally controls what stimuli to ignore and what pain is actually perceived.
Which leads perfectly into our final section. Section 5. The brain constructs pain, the architect of your experience.
Here's the really empowering takeaway from this explainer. Your brain doesn't just passively receive pain signals, it actively builds the experience of pain. Inside your head, the neural circuits for pain and emotion actually overlap in a shared network. It's kind of like nature's economy route. And it perfectly explains why negative emotions, like severe anxiety, fear, or depression, act like gasoline thrown on the fire of chronic pain. If you expect something to hurt, or if you're highly anxious, your brain cranks the pain volume way up.
You can see this chemical reality in how expectations drive outcomes. Take the nocebo effect. If you have a lot of anxiety or expect a treatment to hurt, your brain literally releases a stress hormone called CCK, which blocks relief and increases the pain. On the flip side, the placebo effect shows that positive beliefs prompt your brain to release dopamine and its own natural opioids, naturally decreasing your pain. Your thoughts are literally rewiring your brain chemistry in real time.
Because of this, modern medicine is seeing a massive shift toward biopsychosocial pain management. This means treating the beliefs, emotions, and contexts that shape the pain, not just popping a pill. For instance, programs like POP-C for cancer patients prove that by restoring a person's sense of control and reducing emotional distress, they can drastically improve their daily function. They're finding real relief by changing the narrative their brain is building rather than just masking symptoms.
So it's a completely fascinating paradox to leave you with today. The very organ that sits entirely numb inside your skull is the sole architect of every single ache you have ever felt. But since it constructs that experience, it means you actually hold the key to turning the volume down. If pain is entirely a construction of your brain, what happens when you decide to become the architect?